exam, we're going to look at the soft tissue of the back. We're going to look at the neck, the mid-back, and the lower back. We're going to check range of motion, and we're going to check the muscle condition for balance and integrity. First thing we do when we're looking at the spine is we want to look at the alignment of each particular vertebrae. So we do what's called palpation. Usually palpation, the patient will either be laying face down or sitting. Well, palpation is the actual art of touching the spine and the soft tissue surrounding it to see how the spine is moving. When we determine that a part of the spine isn't moving properly, what we'll do is we'll do a chiropractic adjustment. Chiropractic adjustments are used to help to realign the spine and take pressure off of the spinal column. What's actually moving when we do an adjustment to the spine are the little facet joints right here. If you can look in close here, you can see the facet joint. This is what actually moves when we do the adjustment. The sound that you hear when we do an adjustment is actually gases that are escaping from that joint. It relieves pressure and oftentimes relaxes the body immediately. One of the other ways that we determine what's wrong with the patient when we're doing an initial evaluation is we'll perform x-rays. X-rays are used to show position of the spine. They're used to show if there's any disc degeneration, and we also can see if there's any bone spurs, and we can look at the alignment of the spine. A normal disc spacing and evenly shaped box type vertebrae. So when we look at a person's spine, we want to see that all these components are there. We also look for normal anatomy to make sure that it's safe to actually do an adjustment to a patient. Most patients that have any kind of a chronic condition will usually have some kind of an arthritis or a disc problem that's going on in their spine. So the x-ray helps determine that. For instance, in this particular x-ray here, we can see that this person has disc degeneration at multiple levels with bone spurs. She also has a straightening of the curve out through the front of her, making her head sit forward. So these are all things that over time we can correct with chiropractic care and with specific exercises.